right, Steph, thanks. And now to today's health and our popular segment where we answer the medical questions you are too embarrassed to bring up with your physician. Dr. Keri Peterson is an internist, a contributor to Women's Health magazine, and more importantly, for purposes of our segment, she has heard it all.
Yes, I have.
Right, Keri? You should tell your doctor if you have something embarrassing because they don't care.
No, we don't. We've seen everything, so please ask us if you're concerned.
Okay, we've been collecting questions from folks, and a woman wrote in and she says, I recently developed toenail fungus. Could I have gotten it from getting pedicures?
You can get toenail fungus from pedicures, yes. It's caused by one of many species of fungus that invades the nail just by direct contact. So it is possible to get it through a pedicure, and what happens is it causes the nail to turn a little bit white, and then over time the nail will get a little dull and distorted, but then eventually it does damage the nail, causing it to get thickened and crumbly and brittle and yellow. And you can get them on your fingernails too, but we tend to see them in the toenails because the fungus thrives in a warm and damp environment, which is just like a shoe.
Takes a long time to get over it too, right?
It does. It actually, the topical treatments do not eradicate what's already there. It just causes the new nail to grow out cleanly, so it can take quite some time. And pedicures are also an ideal condition for getting them if the salon does not sterilize the instruments, because you can just pass it from client to client. And showers and locker rooms are also a risky area because they also are moist and damp.
So if you can help it, try to wear slippers or thongs or something when you're on those. Okay,
yes.
And see your doctor if you have it?
And well, one thing you can try is over-the-counter creams and ointments just to put on topically. They don't tend to be that effective, so your dermatologist could offer you many other options. There's a nail polish that you can use for about 6 months. There's an antifungal medication that you can take, and there's even a laser treatment. It's very effective, but it can be a little costly.
All right, toe fungus, check. Let's move on to pink eye. We got a question. I think I have pink eye. I haven't had it since I was a kid. What causes it?
Yeah, pink eye conjunctivitis, just to describe what it is, it's an inflammation of this membrane that sits on the whites of the eye and the inside of the eyelid, and it not only causes pink eyes, but it also causes tearing and itching and a discharge that you'll notice in the morning your eyelashes may be a little more crusty. Now, it's caused by a viral infection most commonly, but also can be caused by a bacterial infection, and it is highly, highly contagious. So if you have it, do not touch your eyes, and if you do, wash your hands. And if you're a parent and your child has it, you could easily get it from them, so follow the same precautions.
So if you had it, should you wash your pillowcase and wash all your sheets? I mean,
well, you certainly should. If you had that discharge on your eye, wash your pillowcase. Discard any mascara or eyeliner that you used, and try to stay makeup free. Take out your contact lenses as well. Yes.
Is this something you definitely have to see the doctor and get the drops, or is it something that ever clears up on its own?
You know, you don't always have to. The majority of cases are viral and they go away on their own in about 3 days. If it's bothering you, there's topical drops just to soothe them. But if the case is more severe and there's thick discharge in your eye, then you may need to see a doctor.
Okay, our next question. I have a wart on my hand. Is it contagious?
It is contagious. Warts are caused by a virus, and they are transmitted when you touch skin-to-skin contact, which could even happen just by shaking hands or even sharing towels and washcloths. But it is difficult for adults to get it because we've built up immunity to the virus by adulthood usually. But kids and young adults are more susceptible simply because they haven't developed that immunity. And if you are an adult and you have a wart on your hand, it could potentially spread to another area of your body. Not likely, but it's possible.
Okay, and so what is the treatment?
Many, many options, and most over-the-counter ones do work well. There's gels, there's pads, there's ointments that you could put on the wart. And for kids, they actually tend to go away on their own, but for adults, they do tend to persist. And if it's really stubborn and it's not responding to the over-the-counters, then you can go to your doctor, who can give you all sorts of prescription topical creams, freeze it, or even get it out if needed.
And you said it's viral, so it's something you can catch. I mean, is the preventive measure the tried and true wash your hands?
That would be another way. I mean, if you're an adult and you have a wart, try to just be cautious not to shake someone's hand if you have it. But again, it's very difficult for an adult to get it.
Okay, last one is a doozy. You ready? Okay. Quote, I've noticed that my urine has a strong odor. Is there something wrong with me, and what is causing it?
Urine odor, yeah, that is something that can be embarrassing to people. Urine odor can vary. It depends on what your kidneys are excreting into the urine, depending on multiple factors. So first, normally dilute urine has no odor. If you're dehydrated and the urine becomes concentrated, it can actually take on this strong ammonia scent. If it's sweet smelling, then that can be due to diabetes. If it's foul smelling, it can be due to vitamins. It can be due to eating certain foods like asparagus.
Okay.
That's a well-known one. And if it's foul-smelling and you're having pain, it could be a urinary tract infection.
Now, is this something you just keep an eye on, and if it continues, maybe go see your doctor, or is it nothing to be alarmed about?
The majority of the time, there is nothing to be concerned about. However, if you're having pain, or if you've stopped eating asparagus and you've stopped your vitamins and you're still having the smell, at Women's Health, we do recommend to see a doctor.
All right, Dr. Keri Peterson, you're earning your salary today. We've got a lot of good questions. Thank you so much.
Thanks, Anna.
And